The nurse is assessing a client with left-sided heart failure. Which of the following findings should the nurse expect? A. Peripheral edema. B. Jugular vein distension. C. Crackles in the lungs. D. Hepatomegaly. Guess your answer. Answer C. Crackles in the lungs. Rationale: left-sided heart failure causes pulmonary congestion, leading to symptoms like crackles, dyspnea, and orthopnea. 2. A client is diagnosed with hypertension and prescribed lisinopril, an ACE inhibitor. Which of the following statements by the client indicates a need for further teaching? A. I should avoid foods high in potassium. B. I may experience a dry cough as a side effect. C. I will stop taking the medication if my blood pressure returns to normal. D. I will monitor my blood pressure regularly. Answer C. I will stop taking the medication if my blood pressure returns to normal. Rationale: hypertension is a chronic condition, and the medication should not be stopped unless instructed by a healthcare provider.
3. A patient with a new onset of atrial fibrillation is prescribed warfarin. Which laboratory value should the nurse monitor closely to ensure safe medication administration? A. Potassium level. B. Hemoglobin level. C. International Normalized Ratio INR. D. Partial thromboplastin time PTT. Answer C. International Normalized Ratio INR. Rationale: INR is monitored to ensure therapeutic anticoagulation with warfarin. 4. A client is taking digoxin for heart failure. Which of the following signs indicate digoxin toxicity? A. Hypertension and bradycardia. B. Confusion and yellow-tinged vision. C. Nausea and increased urine output. D. Diarrhea and tremors. Answer B. Confusion and yellow-tinged vision. Rationale: digoxin toxicity often presents with visual disturbances, for example, yellow or green halos, confusion, and gastrointestinal symptoms. 5. A client with peripheral arterial disease complains of leg pain that occurs when walking and is relieved with rest. What is the term for this symptom? A. Rest pain. B. Intermittent claudication. C. Paresthesia. D. Venous insufficiency. Answer B. Intermittent claudication. Rationale: intermittent claudication is pain in the legs that occurs with exercise due to inadequate blood flow in peripheral arteries. 6. The nurse is caring for a client with a decreased cardiac output. Which of the following factors directly affect cardiac output? Select all that apply. A. Heart rate. B. Stroke volume. C. Blood pressure. D. Peripheral resistance. E. Oxygen saturation. Answer A. Heart rate and B. Stroke volume. Rationale: cardiac output is the product of heart rate and stroke volume. 7. A client with coronary artery disease is prescribed atorvastatin. Which of the following laboratory values should be monitored while the client is on this medication? A. Blood urea nitrogen bun. B. Creatinine clearance. C. Liver function tests LFTs. D. Hemoglobin and hematocrit. Answer C. Liver function tests LFTs. Rationale: statins like atorvastatin can cause liver damage, so LFTs should be monitored to detect any potential hepatotoxicity. Answer C. Sudden onset of severe back pain. Rationale: a ruptured AA typically presents with severe back or abdominal pain, hypotension, and signs of shock due to internal bleeding. 9. A client in the intensive care unit ICU is diagnosed with cardiogenic shock. Which of the following hemodynamic parameters would the nurse expect to find? A. Increased cardiac output. B. Increased preload. C. Decreased afterload. D. Increased heart rate. Answer B. Increased preload. Rationale. In cardiogenic shock, the heart cannot pump effectively, leading to blood backup, which increases preload, the amount of blood returning to the heart. Cardiac output decreases, and compensatory mechanisms often increase heart rate. 10. A client with pericarditis develops signs of cardiac tamponade. Which of the following findings should the nurse expect? Abounding peripheral pulses. B. Hypertension and bradycardia. C. Pulses, paradoxus, and distant heart sounds. D. Increased urine output and warm skin. Answer C. Pulses, paradoxus, and distant heart sounds. Rationale. Cardiac tamponade is a medical emergency where fluid accumulates in the pericardial sac, compressing the heart. This leads to distant heart sounds, hypotension, and pulsus paradoxus. Pulsus paradoxus, a drop in systolic blood pressure during inspiration. How many of these questions did you get right? Let us know in the comments below. If you want to see more videos like this, make sure to hit the subscribe button and turn on notifications so you never miss an update. Stay tuned for more helpful content coming your way.